Welcome to Precision, the HealthCast, where you will learn how to live your best and healthiest life by precisely understanding how your body works, what it is made up of, and how to optimize your health based on that information. I'm your host, Dr. Marvin Singh, founder of Precisionclinic, where we take a highly individualized approach to health, wellness, and longevity by helping amazing people like yourself understand more about their genes, epigenetics, microbiome, sensitivities, toxic exposures, levels of inflammation, and much, much more, for the purpose of creating a highly specific nutrition and lifestyle plan that is flexible and sustainable. I hope you enjoy this week's episode as much as I enjoyed recording it. Hi, everyone. Welcome to my podcast, where we are dedicated to delivering the best and most accurate information regarding precision healthcare from the brightest people in the world. Today, we have a very special guest, and I'm super excited to speak with him. Today, we have Dr. David Caro. Dr. David Caro is President and Chief Innovation Officer at Human Longevity Incorporated. He is an innovative leader who brings more than 10 years of experience in advanced MRI imaging and genomics analytics. Dr. Caro's primary interest is to develop machine learning-based integrated diagnostics that leverage imaging, genetics, and clinical biomarkers to generate more insightful health assessments and identify disease in early stages when it is most treatable. Before joining Human Longevity Incorporated, Dr. Caro was the Director of Body MRI and Director of Acute Care Imaging in the Department of Radiology at the University of California, San Diego, where he still maintains an appointment as an associate professor. During his times at UC San Diego, he implemented advanced diffusion-based methods that proved beneficial for the detection and in vivo characterization of prostate tumors. This work has yielded multiple published papers and led to multiple federal and private research grants on which Dr. Caro was the principal investigator. Dr. Caro is compiling data showing that these techniques may be useful for the screening and staging of cancer across the whole body, including breast cancer. Dr. Caro completed his fellowship in advanced body imaging at University of California, Los Angeles. Prior to fellowship, he completed his residency in diagnostic radiology at UC San Diego. His research during residency was recognized with multiple awards, including the 2011 Elliott C. Lasser Award for Excellence in Research, 2009 American Roentgen Ray Society Executive Council Award, and 2008 RSNA Trainee Research Prize, and his work was also featured on the cover of the September 2010 issue of the journal Radiology. Prior to residency, Dr. Caro completed his medical training at the University of Michigan Medical School, where I did my residency, in the combined MD-PhD medical scientist training program, graduating with a distinction in research. David, welcome to the show.
Thank you, Marvin. It's an honor to be with you this morning.
Likewise. I don't know if we have discussed before that I did my residency at the University of Michigan as well. That was kind of cool.
Oh, yeah. Especially in the fall, I miss Ann Arbor with the leaves turning. It's obviously a beautiful cultural mecca in the Midwest. Love it.
Yeah. I don't miss it so much around this time of the year, but
right.
So let's jump right into it. Tell us a little bit more about yourself from a more personal perspective and how you came about doing what you do. Like, how did you start finding an interest in genomics and radiogenomics?
Yeah, thanks. So, after finishing medical school at the University of Michigan, I migrated, here to the West Coast. And as you mentioned, completed my residency at UC San Diego and then migrated north to UCLA. So at UCLA, my clinical training fellowship was in non-vascular interventional radiology, and that's kind of a mouthful, but basically, among other clinical applications, we would use imaging to guide precision therapy for solid organ tumors, cancer. So we would treat liver cancer and kidney cancer and other cancers as well, using image guidance, radiofrequency ablation, or microwave ablation. And the technique and the application is really novel and powerful because we can treat tumors on an outpatient basis. So our patients would come in, say in the early afternoon. We would literally melt away their tumors with image guidance and radiofrequency ablation. And if all went well, they would leave, that day. And that taught me a lot, actually, as I'm sure with you, your patients tell you a lot, and you learn a lot from them. And I would always, as I'd get to know patients that we were treating, I'd always ask, well, how did you find your tumor? And more often than not, I'd hear a story something like this, which was, well, I got an ultrasound for abdominal pain, and we just sort of, coincidentally found this kidney tumor. Or, I had a cough and got a chest X-ray, and it found this lung mass. So, it just got me thinking, gosh, there's got to be a better way of finding early life-altering disease than capriciousness or serendipity. And so, I kind of migrated from my fellowship, which was in part focused on interventions, and got more interested in how can I use imaging to diagnose early disease, at its earliest stages, whether it was breast cancer or prostate cancer or Alzheimer's disease. And that led me to a 6-year faculty career at UC San Diego, where I had a clinical practice, but also had a research lab that was funded by public and private grants. And the focus of the lab was to derive imaging biomarkers of chronic age-related disease. So, in other words, for prostate cancer, as an example, we wanted to be able to tell our clients, based on all the data we were collecting, including imaging, what is your condition now? Do you have prostate cancer or do you not? But more importantly, based on all the data we were collecting, could we predict your risk for prostate cancer or other chronic age-related disease in the future, a year from now, 5 years from now, 10 years from now? And this work was done in collaboration with Anders Dale, who's a professor in radiology and neurosciences at UCSD. And we slowly got interested in integrating genetic approaches with imaging approaches, especially for the prediction part. So, in other words, based on your genetics and your imaging, again, can we tell you what your current condition is? But more importantly, if you don't have a tumor, that's great. But what is your risk for getting a tumor a year from now, 5 years from now, 10 years from now? And so we published a number of papers in that space, and that interest and work, I think, captured the imagination of the folks at Human Longevity, which of course is right next door to UC San Diego, co-founded by Craig Venter, who's a pioneer in the genomic sciences, having sequenced the first human genome in the year 2000. And as the precision health clinic that Human Longevity operated, called the Health Nucleus, got more interested in imaging and other biomarkers besides genetics, we got to know each other. And I eventually joined HLI full-time a couple of years ago, first kind of wearing my science hat as the chief of radiogenomics and a clinical hat as well, and more recently as president of the company. So that's kind of my lengthy from here to there story, and it's been a fascinating journey.
Awesome. So I guess that's what radiogenomics means. That means taking the imaging studies and combining it with the genetics to make individualized risk prediction. Can you tell us how applicable this is for which kinds of cancers these days, right now, and in this current time, and what we're looking at for the future?
Yes. So, I think a good example of that for males is prostate cancer, and working on similar algorithms in women for breast cancer. As prostate cancer in males, breast cancer in females are the most common cancers. And so being able to not only, again, tell a patient whether or not they have cancer, but being able to predict their risk is important. And why that's important is because if we know, that you have increased risk for breast or prostate cancer, then we can counsel our patients to take steps to mitigate their risk, right? To do X, Y, and Z. and maybe avoid getting the disease in the first place. We call
Mm-hmm.
that previvorship. And you can think about Angelina Jolie, who's been very public about her decision to have a mastectomy, meaning removal of the breast tissue, because she had increased genetic risk for breast cancer, and she discovered that after her mother unfortunately died from breast cancer. So it's these kinds of data, genetic included, that allow patients, to take actionable steps to avoid getting the disease in the first place. And I put that in the context and overall discussion about our current healthcare system, because I think largely, and I think you probably agree, we're still in kind of a sick care system, meaning that the way we diagnose most serious disease, unfortunately, is through symptoms. So, your bladder cancer is diagnosed most often, unfortunately, after symptoms, typically blood in the urine. We as clinicians call that hematuria, but it simply means blood in the urine. And, at that point, the tumor is pretty large. It can be metastatic, meaning it's spread beyond the bladder. And unfortunately, that can mean a pretty poor prognosis. Where we're moving, with bladder cancer, a number of other cancers, and other diseases like Alzheimer's and coronary artery disease, is actually identifying the disease presymptomatically. So finding that bladder cancer at stage 1, and we do that with imaging and genetics in collaboration with you. But I think where we're moving as a healthcare system, and I call it kind of WellCare 2.0, is this idea that, again, we can predict your risk for cancer or chronic age-related disease. And if you have increased risk, we can counsel you to mitigate that risk and hopefully avoid getting the disease in the first place. And that, Marvin, is really the promise, I think, of AI and machine learning, is we get to a point where folks mitigate their risk, they become previvors, and they never get the disease in the first place. And I think, honestly, and I can say this, and I don't think it's hyperbole, although it might sound that way, that's how you get to a place where most of us are living to the age of 100 or over 100, and they're living to the age of 100 healthily. So no one wants to live to 100 if they're the last 20 years or 10 years of their life. It's miserable, right?
Right.
We want to get to a point where folks are largely outside of the sick care system. They're not in hospitals. They're at home. They're with their family and friends. They're doing recreational activities that they love. That's where we want to get to, and I think that's the promise of AI and machine learning. We want folks to live to 100, 120, and not sort of be residing in the conventional sick care system. So that really motivates me every day. It's why I got up at 7 a.m. to talk with you.
I appreciate that. I always tell people that people get sometimes a little freaked out about the idea about knowing about all your genes, and they think that the information is going to be scary, but really it's not scary if you look at it in the right manner and the right perspective. It's not about trying to find out all the ways that you potentially could get sick. It's about finding out all the ways that you potentially could prevent yourself from getting sick, because it's so much easier to deal with the situation before it actually comes to fruition, rather than waiting until, the cat's already out of the bag and then trying to address it at that time.
Exactly. We have this saying for our clients, and as we work together, your clients, which is that we want you, to die. Everyone's going to die. That is one thing that is just unavoidable. But so we want you to die at the age of 120 doing something you love, not of disease. And again, I think through this kind of proactive, actionable precision health assessment, we can actually get to a point where that's possible. And the other thing that I would add is that, when folks socialize with me that they're a little kind of nervous or anxious about the platform or, collecting all that data, I say, look, you're using data to guide deep data to guide nearly every important decision in your life, from your investment decisions. Your car has hundreds of sensors, your social media is data driven, on and on and on. Why in the world wouldn't you be using it, to guide your decisions about health and wellness? And, we should be.
Exactly. That's a good point too.
Yeah.
Support your health at its foundation, your cells. True Niagen is a cellular care supplement that nourishes your cells with a vital micronutrient. It helps promote cellular repair, increase cellular energy, and support cellular metabolism. Support your health by supporting your cells with True Niagen at TrueNiagen.com. Use my discount code MS20 at checkout for $20 off any 3-month order or more. Valid to U.S. customers only, and the code expires at the end of the year 2020. Tell us a little bit about what the experience is like. So say I'm going to come through and I want to have this very highly personalized experience at the Health Nucleus. So what happens from the minute when I walk in the door?
Right. It's a great question. So our clients spend anywhere between 2.5 to 4 hours with us, depending on which assessment they opt for. And, our kind of theory of the case is that, look, if we're going to convince folks to come to see us on an annual basis, we want to create a space that's welcoming and comfortable. We call it a precision health space, but in a way, it's kind of a spa-like setting. So I think the first thing that folks notice when they come in, as opposed to kind of a conventional physician's office or a hospital or a clinic, this doesn't feel like that. We like to say that if you want to know if you're well and stay well, you shouldn't have to go to a place where people are sick. And again, it's this idea of creating almost sort of a parallel system that's kind of separate from the current sick care system. And so that's the first thing that folks notice when they come in. Very large, welcoming lobby, private client rooms with their own bathrooms. Again, sort of a spa-like setting. So you spend a couple hours with us. The testing is no further than 20 to 30 feet from your client room. So all of the imaging, the CT scan, the whole body MRI, blood draw. If you elect to undergo more comprehensive testing, DEXA, 4D echo, an ultrasound of the heart, and so on. And so all of the testing is, again, very convenient. You don't have to cross multiple corridors or wings. It's all right there for you. I think one of the highlights of the experience, in addition to getting the testing and being in a comfortable environment, is the imaging review. So upon finishing the whole body MRI, you'll meet in person with our radiologist, and there's a large kind of wall size monitor in which he will review your imaging with you right then and there. So when you leave that day, or when your patients leave that day, they have kind of a full understanding of what's going on in their body, and that's really remarkable. And I think most folks really appreciate that, because while we've all had thousands of pictures taken of us by loved ones and friends and family and all that, not many of us have actually kind of had a look at what's going on inside. And so this is really the first time most folks have, kind of seen a head to toe approach to looking at their body. And we look at, everything from, the beating heart to the fat that's around your liver, to your liver fat, to your brain and atrophy, hopefully lack thereof in the brain. And all of this is, again, important for this, what is my condition now? But more importantly, what is my risk in the future for dementia, coronary artery disease, diabetes, cancer? So it's a really powerful evaluation, a powerful review. And at that point, Marvin, our clients leave again anywhere between 2.5 to 4 hours after the beginning of the testing. And after the imaging review, we're assessing and integrating all of the data sort of behind the scenes. The blood that we collect is used to evaluate blood chemistries, but also for the whole genome sequencing. The whole genome sequencing takes between 4 and 6 weeks. So after that is completed, we integrate all the data together. And that's the point of the assessment, is we're not just doing a la carte, like whole body imaging, or a la carte whole genome sequencing, but we're integrating genetics, imaging, and blood markers, integrating it all together with AI and machine learning. And then 6 weeks later, we either meet with the client in person if they're local, or by WebEx if they're not. And for about an hour, review all the data with our physicians and with you. You'll be returning all the results, of course, to your patients. And we have genetic counselors where there is a significant genetic finding. And during that 1 hour return, as we work together, again, it's really about informing our clients about their disease status now. But, again, many of our clients don't have tumors or aneurysms or significant coronary artery disease, but it's really about counseling them on their risk for disease in the future and giving them actionable health intelligence.
Awesome. So what's an example of, a life-altering gene mutation or something that's really significant. Maybe that happened in that that was discovered in an actual client, and what happened to them subsequent to that. Like, can you take us all through that process? Let's say something's discovered, and then what happens next?
Yes. And that's, I think, a real powerful, kind of anecdote to what we do. So we're very thoughtful about our science and our clinical applications. We've published 60 plus papers in really high impact journals like Science, Nature Genetics. And what we've learned now, we've seen over 5,000 clients. We have a summary and a publication that's in review, the first 1,200 clients, and we expect it to be published soon. But here's the bottom line and the takeaway for anyone who's interested is that the folks that come to see us are presumed healthy. So they come in. In fact, we'll have a lot of couples come in. They'll have separate client rooms or the same client room, and it's often kind of sort of a fun, affirming experience for couples who come in, families. But sometimes I'll have the husband and I'll have a conversation and he'll say, "Oh, well, I came in. My wife really wanted me to come in, but you're not going to find anything. I'm healthy." And you think you're healthy, but do you know you're healthy? And I think what we're showing is that presumed healthy individuals may not be so healthy. And in fact, 40% of the folks who come to see us, who are again presumed healthy, have a clinically significant finding that we're identifying that wasn't previously known. And 14% have a clinically significant life altering finding. So you asked what that looks like. Well, that's 1 in 50 with a previously unknown early stage high grade tumor or a brain or aortic aneurysm. It's nearly 10% with advanced coronary artery disease that wasn't previously known. 30% with evidence for diabetes or prediabetes, metabolic syndrome, elevated liver fat that wasn't previously known. And there's actually sort of a laundry list of other findings. But here's an interesting one as well. So 1 in 5, nearly 20%, when we look at their genome, have a rare genetic mutation that they didn't know about, and which is often very highly actionable. So, you asked for an example. We've had men and women where we've diagnosed BRCA mutation. Many of our listeners today, will have heard about BRCA. It's a gene that, when mutated, increases a woman's risk for breast and ovarian cancer, and in males increases our risk for prostate cancer. So famously, again, Angelina Jolie had her breast tissue removed because she had a mutation in this gene. So those are the kinds of genetic mutations that we're finding. In general, when we make a genetic discovery, we know that we're not just making kind of esoteric, philosophical discoveries, because many of the times, actually 63% of the time, we're correlating that genetic finding with the finding on MRI or in the blood. So we have a gene for elevated cholesterol when it's mutated, and we're finding in the blood that the patient has high cholesterol. We find a gene that, when mutated, causes heart failure or cardiomyopathy. We see in the MRI that there's left ventricular hypertrophy and so on. So the good news is that, just like all the other findings, if you identify a genetic mutation early, before the disease has presented itself, there's often a lot you can do to avoid getting the disease or mitigate the disease if you get it. So, I think about some of our earlier clients, some of our clients who have been very public about their stories, famous scientist, Nobel laureate who's local, who was, again, presumed healthy in his 80s, who we identified mediastinal lymphoma. And he was treated in his 80s with chemotherapy and radiation. And he's, back in his science lab at JCBI, working every day, doing what he loves. And, the tumor that we found was high grade. So if we hadn't found it, probably a year to 2 years later, it would have been metastatic. And that would have been a terrible prognosis. So those are just, some of the stories that we see that are pretty common.
Wow, so these are people that are just walking, talking, regular people going about their own lives, think that everything's just fine, and do this testing and discover that, maybe it really isn't just fine. But the beauty is that you can actually learn about it way before you actually develop any symptoms or advanced disease, and take care of it so that you can improve your quality and length of life. That's exactly what you were talking about earlier.
That's right, Marvin. And I even take kind of the most sort of frustrating case, and many of our clients will say, "Yeah, okay, I want to know about my current condition and risk for cancer because that makes sense, right? If I can find a tumor early, we can cut it out, we can ablate it." Coronary artery disease. Yeah, I want to know about that because, I've heard that you can put stents in the coronary arteries if I have significant disease. But the one thing I don't want to know about is dementia because, I've heard you can't do anything about that. And
Yeah.
even here, I would push back, right? Because, as more and more evidence is accumulated, what we're understanding is that, like most other chronic age related disease, even Alzheimer's dementia, when identified early, is to a fair degree preventable. So we know there's been many recent publications which show that a third of the risk, and actually many neurologists in this space think it's even closer to 50%, but at least a third of the risk for dementia is modifiable, meaning it's kind of in your control. I always say to clients who are anxious about getting kind of a readout on their risk for dementia, I say, look, it is true that if we identify that you've already lost part of your mesial temporal lobe, that's the part of your brain that undergoes atrophy in Alzheimer's, you've already lost neurons to the disease. It is true, I can't really do anything, we can't do anything today to kind of regrow those neurons, but if I can identify your risk for dementia 10 years before disease onset, before you ever have any symptoms or any atrophy, there's actually a lot we can do to mitigate that risk. And that's everything from lowering cholesterol and blood pressure. It's watching your BMI and your liver fat, watching alcohol and tobacco use and all that. And I would argue that it's just a whole different conversation if you tell a patient, hey, you're in your 60s, say you're 65, we've identified that you're at above average risk for Alzheimer's, and look, your number one personalized risk factor is BMI. And so then telling someone in their 60s, we've got to find a way to lower your BMI is a very different conversation than just saying, hey, buddy, lose weight, right?
Hmm.
So that's kind of the actionable insights that we have. And even something like dementia, which, again, many of our clients are anxious about. It turns out if you can identify risk ahead of time, there's a lot we can do about it.
Awesome. What do you tell people, that say, well, I did the 23andMe, I did a couple of these gene tests. I don't really need to know my whole genome. What's the difference between checking for these little individual SNPs or these individual genes versus looking at the whole genome?
Right. It's a great question and a question we get from many of our clients. So, look, I'm a big 23andMe fan. I'm a 23andMe customer, and I think they've done a great job of, and I think they have close to 5 million customers now. They've done a great job of getting folks interested into genomics, and that, from my perspective, is awesome.
Hmm.
But what I would say is that 23andMe tends to be somewhat more recreational. They do have some health insights, but it's not very comprehensive. So what they're looking at when you send your saliva to them is really just a fraction of your genome. So your genome has 6 billion base pairs. Okay. They're looking at about 700,000 markers. So it's really like the first word, the first letter of the first sentence in the 25 chapter 3,000 page book, right? And so you get some insights, but it's very limited. Here's an example, Marvin, just to kind of make it more concrete.
Uh-huh.
So many of our folks, our female clients are interested in their risk for breast cancer. So if you go and get 23andMe's assessment, there is an evaluation of your BRCA, status, so whether you have a BRCA mutation. But we know there's over 1,000 medically significant mutations or variants in the BRCA gene that put a woman at risk for breast cancer. 23andMe looks at 3 of those. So 997 are left kind of unchecked. And so, I have to say that's unfortunate because then a client who gets that assessment, if they don't read the fine print, and who does, when we see fine print, we just kind of gloss over, right? And so, if someone gets kind of a negative result from 23andMe, they're like, oh my God, that's great. I don't have to worry about this. But, it's not really great because there's 997 significant variants that weren't looked at. So our assessment, we sequence all 6 billion base pairs, and, we're looking at all of those variants in BRCA and all the variants in every other gene that could put you at risk for chronic age-related disease. I think the other way that we're different is that we don't believe in a la carte genomic testing. We don't believe in a la carte whole body imaging. There's also, a sprinkle of folks who are now saying, "Hey, come and get your whole body MRI." Look, if you want to know about your risk for disease, it's kind of Pollyannish or too kind of simple to say, well, we're just going to look at your genetic risk or your imaging risk or your blood biomarker risk. You really got to integrate all those powerful biomarkers together to give you an accurate picture of what your risk is. And so, for everything from dementia to breast cancer to prostate cancer, if you're just looking at one of those modalities, you can only get so far in your risk prediction. Now, if you add them all together, you integrate it together, often with AI, you can actually get a risk prediction algorithm that's super predictive. And that's our goal. And I think that's how we're different, not only from 23andMe, but a number of other, Me Too's that are sort of in this space.
It almost sounds like saying, "Hey, send me a picture of yourself," and you send a picture of a hand. It's
Exactly.
like, how can I tell what your body looks like if I'm only getting one piece of it? But if you take all the little pieces together, then you can actually get a better assessment of what the person is actually looking like.
That's absolutely right.
So this is really cool, advanced type of an approach to looking at somebody's whole health. How do you think healthcare is going to be in 10 years? Are we all going to be doing this? Is this going to be kind of like you walk in the door to your doctor and you get a physical and they send you for a whole body MRI with genomics and all these special labs and then they give you an assessment?
No doubt. We feel we're on the bleeding edge. Look, here's the reality, unfortunately, and this is not just a US problem, it's a global problem. We spend 17% of our gross domestic product, our GDP, on healthcare. And everyone commonly talks about kind of our military spending as being out of control, but actually, our military spending is a fraction of our healthcare spending. And so, unfortunately, that's not sustainable. It's actually growing to 20% of GDP. It's really kind of a house of cards is going to fall in on itself. And so something's got to change. And you might ask, well, why is that? Why are we spending so much? Well, we're, in a way, spending it in the wrong places. So 98% of our spend is spent on the sick care portion, the symptom based portion, not on well care. And actually, Marvin, what we get for that, and I know you know this in your own practice, and we all know this because of family members, but this is a statistic that's actually kind of well known in sort of the circles I deal with. Turns out that if you live to the age of 50 in the United States, you have a 1 in 4, 25% chance, unfortunately, of not making it to age 75. And, nearly every day you pick up the paper and you hear about someone, relatively famous that died before the age of 75. There was just a kind of a famous executive yesterday in the news. And you all know this in your family too, right? I looked in my family when I first heard that statistic. I'm like, this can't possibly be true. And I looked in my own family tree, it was actually worse. So that's what we're getting for our healthcare spend. Not only is the spend kind of out of control, we're not actually getting good results, right? And again, the reason I think for those poor results, the fact that 1 in 4 of us won't make it to the age of 25. By the way, globally, that statistic is 1 in 3. So it's 33% of folks globally won't make it to the age of 75. The
Wow.
reason that we're getting that unfortunate result is that we're not investing in the right space. We're investing in the sick care portion, not the well care portion. And so, I would say that actually we do a pretty good job as a healthcare system of, hey, if we identify your tumor, we do a pretty good job of treating it, interventional radiologists, radiation oncologists, surgeons, all that. But we do a horrible job of predicting disease and getting you to a point where you can avoid disease or mitigate your risk. And so that's where we have to turn as a healthcare system. And the only way to get there is to take a more data-driven approach. So, you and I know through our practices that the last 30 years, in general, the way that we've guided decision support for health and wellness has been through the annual physical exam. And, largely that hasn't changed in the last 30 years. It's pretty superficial. You probably have a more exhaustive approach historically in your practice, but the bottom line is most of us, when we go to see our doctors for the annual physical exam, it's the stethoscope, the reflex hammer, the tongue depressor. We want to know about, our family history. Our doctor asks us, what did mom and dad have? There's been no genomic sequencing. And the whole idea is to move this, into something that's more personalized, precision medicine based, more data driven. And I think that's what we're doing at HLI. is offering this data-driven approach. We collect 100 gigabytes of data. It'll be a terabyte of data soon, and that allows us to make meaningful, actionable insights. And getting to your question, I have no doubt that that's the future. Right now, our costs have come down significantly since we started 3 years ago. And as those costs come down, we pass that along to our clients. So no doubt, in the next 3 or 4 years, the same assessment will be accessible by every middle-class family. And I think that's how we get to a place really where, again, we're all living to the age of 100, but we're living to the age of 100, with a healthy human lifespan.
Awesome. Are there any new technologies or breakthroughs that are being anticipated coming up in the near future that could help, further this type of an assessment?
Yeah, it's a great question. Our assessment is kind of a dynamic one, and again, that's why we don't do a la carte testing, and we don't think that we can do it all sort of in house or kind of invent it all on our own. There's folks doing work on proteomics and metabolomics and microbiome. So we're kind of an aggregator of all these technologies, and there's billions of dollars that are invested annually in the National Institutes of Health. We can't possibly compete, nor do we want to, with those massive research budgets. What we're doing is we're taking all the kind of best and the brightest and the cutting edge and integrating it into our assessment. And, again, depending on what our clients elect, that's everything from microbiome to metabolomics in the blood, again, advanced whole body imaging, whole genome sequencing, pharmacogenomics, and there's many other parts of the testing that we do. But no doubt, next year there'll be advancements that we'll want to incorporate into our practice. So the whole idea is, again, we're going to aggregate all of these tests into one place where you can come as a patient and client with your family members and get it done without having to go to multiple centers, multiple corridors, and get it all in one place.
Awesome. That's exactly been my approach the last several years as well, is to try to be the one place where all the information is collected and helping to educate people about what their risks are and how they should, approach their life going forward and what particular things to follow, because it's so much easier when you don't have to go, from place to place to place to try to put the pieces of the puzzle together yourself.
Exactly. Well, Marvin, we're really excited to work with you. In a way, I think what we have is kind of half of a whole product solution. So we're, as a technology company, we're really great at kind of analytics and diagnostics. Again, putting the data together to inform our patients and clients about risk. But what's important for our patients and clients is the other half, which is the actionability part. So kind of marrying precision analytics, which is what we provide, with precision therapeutics. And that those precision therapeutics might be everything from, hey, you need a surgeon to look at this early tumor that we identified, or it might be, you've really got to focus on lifestyle changes like diet and exercise to get your BMI or liver fat down. In the future, it might be regenerative stem cell therapy. In the future, regrow cartilage, for example, in your knee, so you don't need a knee replacement. But that's not what we do. That's why we're so excited by our partnership with you, which is so that you together with HLI and the Health Nucleus can create this data-driven precision health whole product solution for your patients.
Awesome. Such an exciting future we have ahead of us with regards to how to take care of patients. It's kind of like reinventing medicine, I think.
I really think so. It's why I've been doing this for the last 3 years. I'm kind of an academic at heart, but I think one of the weaknesses of the big sort of siloed academic medical healthcare systems, and we know and I know and love them, and so do you. We both went to the University of Michigan. Unfortunately, they're kind of big, sort of lumbering bureaucracies, pretty siloed. Their genetics folks don't talk to their imaging folks, and the list goes on and on. So if I thought that we could make traction, or that I could make traction in precision health in kind of those historical spaces, I'd still be there. And I think, just like, on the West Coast, we've got Tesla reinventing, kind of space travel and, electric cars. There's always going to be a place in this country for innovative, startups who really want to kind of, move the needle. And I think that's what we're doing at Human Longevity.
Awesome. So where can our listeners find you if they want to learn more about HLI and the Health Nucleus?
It's a simple Google search, gets you to our webpage, and you can read about our assessment. In general, we cover four big buckets of disease, neurocognitive, dementia, metabolic, oncologic, and cardiovascular. And so we outline that on our webpage. But we're happy, our team is always happy to discuss with interested folks what the assessment looks like. And so, if you land on your webpage, you'll be directed to a phone number. We can speak to one of our counselors to get a kind of a telephone review of what we do.
Perfect. Well, I want to thank you so much for being a guest on the show. I loved the discussion. I'm sure everybody enjoyed it as well and definitely learned something from it.
Thanks a lot, Marvin. It's great to get to know you and to work with you.
Thank you. Have a great day. And thank you to all of our listeners for tuning in today and listening to another exciting episode of Precision, the HealthCast. We hope you've enjoyed this episode of Precision, the HealthCast, the one and only podcast truly dedicated to helping you understand how to live long and personalize your health. I'm your host, Dr. Marvin Singh. Until next time. I want to take a moment to tell you about Precisionclinic, a unique medical clinic that I founded in 2019. Precisionclinic is the only practice in the United States that uses Precisionomics to help optimize health and improve longevity by using cutting-edge science and technology to create highly personalized recommendations and protocols, no matter what your health goals may be. Give us a call and learn more about our customized and comprehensive evaluations that can all be done from the comfort of your home by telemedicine. Our phone number is 858-229-7589. Or you can email me at admin@precisionclinic.com, admin@precisionclinic.com. We're looking forward to hearing from you.